Hello, I'm Dr. Bill Waggoner. For today's Tuesday tip, I want to address the question, if I should need to remove a zirconia crown, how do I do it? First, we should address why you might need to remove a zirconia crown after it's been cemented. I can think of only a few reasons. Perhaps you were cementing 4 upper anterior crowns and one of them somehow rotated or floated and you didn't notice the malalignment until it was too late. Another scenario may be a posterior crown that just didn't seat well, and it wasn't until after complete cementation that you noticed that it was very high in occlusion. Or maybe a zirconia crown has been on the tooth for several months, and now there are signs and symptoms of pulpal degeneration, and you need to intervene with pulpal therapy. I'm not saying that any of these scenarios actually require removal, but they might. If there's a need to do pulpal therapy after cementation of a zirconia crown, it is possible to cut an endo access opening through the crown and then seal it with composite or resin-modified glass ionomer. If you attempt an endo opening, it's recommended that you use a coarse round diamond with lots of water spray to make the opening. But be aware that this could cause microfractures in the crown that could cause failure later on. However, depending on the cooperative ability of the child and the length of time that the tooth needs to be in the mouth, it may be worth a try, since the only alternative to most people is to destroy the crown by cutting it off. So in order to cut it off, you must use a coarse diamond with lots of water. No carbide burrs. They will spark and they will break. If you cut the crown up the facial or lingual surfaces onto the incisal or occlusal, you can usually then take a flat-bladed instrument and put it into the cut area, apply a slight torque, and the crown will break. Now this is best done under a rubber dam or some kind of isolation that would prevent any pieces of the broken crown from falling into the mouth. I really want to emphasize the need for lots of water when cutting these off. Even diamond burrs can create a lot of sparks when cutting zirconia. Now there is one other way of removing zirconia crowns that I'm aware of. An article that was published last year reported that they successfully used a Biolase water-lase laser to irradiate cemented zirconia crowns and remove them without harm to the tooth or the crown. It took a little over 2 minutes of irradiation to debond the crowns that had been cemented with a resin-modified glass ionomer cement. Now, I'm not a laser guy, but I do know that there are a number of types of lasers for use in dentistry. Whether a type other than the water lase that was used in this particular study would work, I have no idea. So for me, and for most of you listening, I would say that your best and maybe only way of removing a cemented zirconia crown is with that coarse diamond with water spray. I do want to say that I really don't think many of these should need to be removed. We don't remove that many stainless steel crowns or signature crowns, so the need to remove a zirconia crown should be comparably small. Well, that's it for today. I hope that this is actually a pretty useless tip for most of you, meaning that you never have to remove a zirconia crown. But if you do, now you know what to do. Stay well, and I'll see you next time. Thanks for listening.